Health Canada this week is expected to approve Canada's third vaccine, the Oxford-AstraZeneca vaccine. Once that happens, the first doses are due to arrive by the end of March. Canada will receive about 475,000 doses through COVAX, the global vaccine sharing program the Liberals have been criticized for accessing. Canada has secured 1.9 million Oxford-AstraZeneca doses in total through COVAX. Today, we're hearing reaction out of the UK, where the vaccine was developed, after South Africa announced it is suspending vaccinations over concerns about the effectiveness of that shot. And Dominic Velitis has the latest out of Bristol, England. Let us begin with South Africa, Dom, why they've decided to suspend the vaccination of this Oxford-AstraZeneca vaccine in that country.
Yeah, good morning, Heather. Well, South Africa, as you know, was due to start administering around about 1 million doses of the Oxford-AstraZeneca vaccine from next week. That rollout now on hold after this study, which I should stress is yet to be peer-reviewed, found it only offers minimal protection against mild and moderate cases of COVID-19 caused by the variant first identified in South Africa. And instead, Heather, the authorities there will now only offer vaccines made by Johnson & Johnson and Pfizer in the coming weeks until clarity can be sought. Now, what they can't work out at the moment, Heather, is if the AstraZeneca Oxford vaccine protects against severe disease caused by this particular variant. And that's because the volunteers who took part in the trial, which formed the bulk of the study, were pretty young. They were aged about 31 on average. And it's important because people with severe disease have an impact on frontline health services. The general feeling today, Heather, is this vaccine, the Oxford-AstraZeneca vaccine, probably will protect against severe disease. Those behind the study think it will likely offer similar protection against the most serious cases as the Johnson & Johnson vaccine. But of course, that needs testing. A definitive answer, we're told, is expected soon, Heather.
So, of course, this Oxford-AstraZeneca vaccine, Dominic, was developed at Oxford in the UK. What has been the reaction from health officials there? There was such pride in this vaccine, was seen as the world leader when it was first emerging. And what are they saying about this setback?
Yeah, and I think, Heather, there is general interest globally in this particular vaccine. It was designed with accessibility in mind. It has been described as the workhorse vaccine for the world. It is a lot cheaper, a lot easier to distribute. The government here, though, I have to say, seems fairly relaxed about these findings. It's pointing to the fact that there is no evidence in this study, or indeed elsewhere, that the Oxford-AstraZeneca vaccine does not prevent serious illness, hospitalization, or even death. And although the latest figures show 147 people here in the UK are infected with the variant first discovered in South Africa, it is not the dominant strain. I think, Heather, there is a growing acknowledgement that coronavirus, whatever form it may be, will be with us for some time, and that booster shots like those you get with the flu will become the norm, Heather.
Dominic Velitis in Bristol. Thank you, Dom. Appreciate it.